Hello, my name is Andy Medvick. I'm the owner and founder of MEDSource, and this is the hip distraction unit for hip arthroscopy. We are at the University of Colorado campus, Center for Surgical Innovation, the Bioskills lab. When receiving a hip distractor, remove the unit from the case. We include a foam for packing purposes only. Simply remove the hip distractor from the spill tray, set the foam aside, put the hip distractor back into the tray. We also include a spill pad for fluid that gets on the floor, suction tubing in case you don't have it readily available, a bump, which I'll explain on positioning the patient. We have a cardboard box which is packed between the tray, and this includes a cleaning brush, 2 straps, I'll explain, enzymatic cleaner for cleanup, a couple of wrenches, 5 drill bits. And we also highly recommend that you use eye protection during the event for shards of steel that may flex during the distraction phase. If they break, eye protection will be appreciated. When the hip distractor is on the radiolucent table, take one of 2 provided straps, looking at the MEDSource label up, place it into the tower, through the other side of the tower, underneath the table, and connect it to the strap to secure it in place. And this will prevent the hip distraction unit from moving during the case. Hip distractor consists of a fluid retention tray, the hip distractor itself, which consists of 2 towers, a flywheel, adjustable clamps for the size of the anatomy, a second flywheel to turn that anatomy, a suction port for fluid that gathers inside the tray. The towers are adjustable per the anatomy. It's a good idea to have a tape measure on hand to measure your anatomy as far as the length, and then adjust the tower accordingly. You can move these towers forward. There are several holes to move the anatomy forward based on the size of your anatomy. Please be aware of that. We recommend that you move the back tower with the flywheel first before using the secondary tower in front. The 2 plates have drill guides in both sides. Drill guide on one side is larger than the other. However, the smaller guide is cored in both directions so that as you're drilling through the anatomy with your drill bit, it'll have an easier time grabbing into that drill bit because it is simply cored out in the center. Be aware that based on the size of the anatomy, you can put the drill guides on the inside of the plate or the outside. Moving into the anatomy, we provide you with a bump, and the bump is there merely to position the anatomy. The anatomy for this lab is a paper mache wrapped in Coban, nice red color so it shows up easier. Based on the height of the anatomy, I'm going to move back the flywheel. Once you place your drill bit through the femur, simply take your cable. There's an eye at both sides. Place the cable through both sides of the drill bit. Bring forward your flywheel and grab the cable into the flywheel, distract slightly. And to ensure a tight fit to where you don't lose the eyelet, simply use a zip tie provided and zip tie the 2 ends together to keep them tight during the distraction phase. For the hip portion, we recommend using 3 drill bits and a standard OR version drill with Jacob's chuck and a key. For demonstration purposes, I'm using 2 drill bits, but we do recommend 3. During the procedure, the entire area is radiolucent. The wheel on this side can be used to rotate the anatomy. When drilling the hip into the plates, the drill guides can be placed on the outside or the inside, depending on the width of the anatomy. By placing the drill guide on the inside, you're less likely to bend and torque those drill bits as you're distracting, and less likely to char and break a drill bit. We provide a suction port with holes on both sides, so it can be placed on either side. Simply connect your suction, and we recommend that you raise the nozzle about 1/4 inch, 1/2 inch off the surface, and use the tightening knob to make sure that it's tight, and this prevents the gurgling sound you get from the suction at the bottom of the tray. At the conclusion of the lab, the straps are going to be bloody, the suction will be bloody. Get rid of your suction entirely, toss it into a red bag waste, cut your strap, and put it into waste. When you're ready for the cleaning phase, fully disassemble the unit. We provide you with an enzymatic cleaning solution, a cleaning brush, 2 pipe cleaners, and disinfectant towelettes. Using the spray, simply spray the contents on all of the soiled material. Once you are sprayed with the plates, simply take the large cleaning brush and pass it through the holes. Make sure that there is no residual blood or tissue on those plates. It's recommended that you use cold water in this process, as enzymes will be destroyed in hot water. Now that the unit is washed, disinfected, and reassembled, simply take the clean tray, grab your foam packing material, place it inside the tray, pick up the hip distractor, place it into the foam, and it should seat nicely.